Speaking of inspiration, 100 years from now, when we have a library full of nursing books that you look back on, there's one tome of books that I'm sure is going to be here, and you would have had to have been inspired to write this amazing, the history of Australian nurses in the First World War. It's 4 books together, and the author and researcher is with me now. Dr. Ruth Ray has been a registered nurse since 1978 and has worked as a freelance researcher and writer for more than 20 years. We are launching this book today, and Dr. Ruth Ray has kindly consented to signing these books during morning tea as well. But before I tell you more about that, would you please welcome somebody who's obviously put a great deal of time and effort into our industry. Please welcome Dr. Ruth Ray.
Thank you. Thank you. I believe it's very appropriate that the trilogy that I've written about Australian nurses who served in the First World War should be launched here today at the 2015 National Nursing Forum. I think a lot of my First World War nurse leaders would have really enjoyed the last speaker. It's a forum where nurse leaders, not just from Australia but from around the world, are here today, and they're meeting and discussing the future of our profession. But many here, no doubt, believe that our profession is at a crossroads. Issues such as the management of information technology, professional relevance, strategic political alliances, and clinical responsiveness to the changing demographics of our communities are just a few which need to be addressed today. But you may be surprised to hear that the nurses whose lives have been detailed in these 3 books, From Narromine to the Nile, Scarlet Poppies, Veiled Lives, and those listed in the nominal roll, they had similar concerns in 1915. However, these concerns were put on hold to some extent as the First World War dominated the global conversation. It was a conversation in which few women could contribute unless they were qualified nurses. That is, sorry, I'm not allergic. I'm not contagious, I'm just very allergic. So forgive me. One of the things I noticed when writing the history of Australian nurses in the First World War was there was often reference to the generic nurse. And whereas the military nurse was a bit similar in that they were sort of mentioned in part, but hardly. There'll be a photograph with no caption. And so if there was a military soldier who was a leader, he would have a name, a short, succinct biography, but not so the nurses. And so the first book, From Narromine to the Nile, actually tells the story of one Australian nurse, Jessie Tomlins, who was my maternal great aunt, in some detail. Jessie, like me, and anyone else in the audience who happens to be hospital trained, which gives away our age quite a bit, she basically, and so did I, trained under the Nightingale system of nurse training. It was the similarities in her training between 1912 and 1916 to mine in the mid-1970s which really ignited my interest. Actually, there's a good friend of mine here today, Jenny McKenzie, who's responsible for me becoming a nurse when I was 17, and we've remained friends for 40 odd years, and she's come to all my launches and she's here today. So when Jenny and I were training at Parramatta Hospital in Western Sydney, I was aware that Jessie, who trained at Sydney Hospital, left that training experience, and her first placement was at the 14th Australian General Hospital in Egypt, where she cared for the casualties of the Australian Light Horse. And I tried to imagine having my level of expertise and transferring that to that war area. So the second book, Scarlet Poppies, satisfied my other passion, which is politics. I was interested in what it was like for a female nurse to be part of the male-dominated army during the years 1914-18. And what is clear is while they enjoyed the respect and often the affection of the soldier patients, they were not always made welcome in the army. Not integral to the policy-making process, but certainly essential to the implementation of policies made by others, which hasn't much changed, actually, in some ways. But Scarlet Poppies gives examples of our professional antecedents who were able to, for instance, sail minefield oceans and evacuate a ship in the middle of a typhoon. They were able to wear the heavy, full-faced, oppressive infection control uniform in 40-degree heat in the middle of India, or they could stand for 20 hours at a time on duckboards, sinking into the mud of Flanders in the makeshift operating theatres of the casualty clearing stations. And while they tolerated the terrible administrative injustices of a male-dominated military regime, they continued to care for soldiers who were not just battle wounds, but they suffered from dysentery, bubonic plague, scarlet fever, malaria, and the most horrific, the pneumonic influenza of 1918 to 1919. So it was their shared experiences which gave them this professional spirit, a shared resilience, never an attitude of concession and very rarely complaining, unless, of course, it was to each other, but then that's a nursing tradition. We're allowed to complain to each other. So I'm in constant wonder at their skills, but don't let that lead you to believe that this trilogy is about ministering angels or handmaidens. It is not, because they were neither. They were flesh and blood women, and these books are about the reality of war, and they're about the reality of nursing in war. The third book, Veiled Lives, examines the social and demographic background of a number of nurses before detailing their army experience. These women, who trained the way we did, but served in the bloodiest war of the 20th century, worked so hard that they became weary in body and soul. They cared for many soldiers, young men like them in their 20s, who at any other time in history would have been prospective husbands. They watched these men die terrible deaths, and they grieved. They fell in love, and many lost the love of their lives to this brutal war, and many never recovered from that loss. I've estimated that 40 Australian nurses died in this war, and these nurses were human in a very inhumane world, and I'm surprised that any of them were able to come home and retain their grace and continue to work and function with any semblance of normality. They not only did that, they became extraordinary nurse leaders, and some of them, we have great debts to them, what they did in the 1930s when they returned. The Australian College of Nursing Nominal Roll lists the name of 2,468 civilian-trained nurses, not just those who served in the Australian Army Nursing Service, but those who served overseas. That's the fourth part of this trilogy. I know it's a trilogy and there's 4 books, but actually it is a trilogy with an addendum. I've included qualified nurses who joined other overseas nursing services, Red Cross units, as well as the 500 Australian nurses who served in India, but it was considered to be home service, believe it or not. So they don't rate a mention on the Australian War Memorial Nominal Roll. I'll say that number again because it's actually been intriguing, 2,468, 2468. Anyone asks you how many Australian nurses served, qualified nurses served overseas, you will all remember it now. And whenever I lost a few, others would appear. It would just be like it was meant to be. It was quite astounding. Now, while I may have researched and written these 3 books and the nominal roll over the last 18 years, the reason that you're in a position to read these words, to embrace your own history, is down to Deborah Toms and the Australian College of Nursing. Her leadership and the board of the Australian College of Nursing, as well as the editorial input of the Trilogy Working Party, clearly demonstrates to those here today that our history matters. I'm also pleased that Kylie Ward, the recently appointed CEO of the College of Nursing, is here today. I noticed that, like me, she has a keen interest in aged care, which is actually where I got my interest in social history, which ended up being 4 books on World War I history. And as I've lived in rural Australia for 30 years, I'm also passionate about rural health, which I noticed she is as well. Now, I've worked closely with a number of Australian College of Nursing staff members on this quite large project, but I'm loath to mention individuals because I'm fully well aware that there's many who've been working tirelessly behind the scenes, and I'm most grateful to them. However, I must mention a few past and present staff members, including Tim Spooner, Phoebe Glover, Wendy Hook, and Olivia Anderson. Also, Jackie Poyser was instrumental in getting the trilogy to fruition, and I'm most grateful to all of those who have been working tirelessly behind the scenes for the publication, the promotion, and the distribution of the trilogy. But in conclusion, I have for a number of years tried to understand why military history books fail to include the experiences of nurses who cared for battle casualties. And I suspect that the absence of historical data about these Australian nurses may be linked to the fact that they were witnesses. For example, nurses saw their soldiers at their most vulnerable. They witnessed how they responded to disease, pain, and fear, how these young men responded to the very prospect of their own death. Nurses witnessed how these men responded to grief, whether it be the heart-wrenching grief of finding out that one of your parents has died while you've been on active service, the never-ending and forever compounding grief of the loss of your mate, or the acute grief which comes from realising that even though you're a young man, you will never walk again, you may never see again, you may never hear again, and you'll have no use of your arms again. Finally, when these nurses tried to poetically soften the close of their soldier life, it was often accompanied by the sounds of the brave soldier crying for his mother. These observations, this unwritten history, does not bode well for the image of the brave, strong Australian soldier, not from a military perspective at any rate. But I believe the history of these nurses substantially adds to the body of knowledge we have about what it is to be human amidst such inhumanity. So thank you for your attention today. Now, if you choose to read the trilogy, I hope you'll gain some insight into the reality of war from a very different perspective. I also hope that you take away with you a sense of pride in your professional heritage, pride in being an Australian nurse. Thank you.